Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
In females complaining of delayed menstruation for about 10 days, if the female is sexually active, then first you should get a urinary pregnancy test done. If the urinary pregnancy test is positive, then pregnancy is the most common cause of secondary amenorrhea. But then in pregnancy, there will be increased progesterone levels mainly to support the pregnant endometrium or to support the decidua, and thus there is no menstruation. After delivery, placenta will be removed and the progesterone levels decreases. There will be shedding of decidua leading to lochia formation. Then, if urinary pregnancy test is negative, then we should reduce the progesterone levels. This reduction of progesterone levels will lead to shedding of the endometrium and thus leading to menstruation. Drug like meproate 10 milligrams BD or TDS is given for 5 to 7 days. This meprate will increase the progesterone levels. Once the meprate levels are stopped, progesterone level falls down, leading to loss of endometrial support, thus causing menstruation.
thank you and thank you for watching.